Now we're going to look at a single leg squat
as part of Phase 4.
which is important to perform for the strengthening of the leg. For all of these variations, you're going to be standing on the involved leg and squatting with the involved leg. During the squat, it's important that your rear end leads first, the weight is loaded into the heel, the knee remains behind the toe, and we see no inward movement of the knee. If you encounter any of these, you should stop and restart the squat. If you cannot control for these dynamics, you should not be single leg squatting and consult your therapist for further direction. The first is going to be a single leg squat with a non-involved hip in extension or backwards. To perform this, you'll lift the non-involved leg, placing it behind you, and begin to squat on the involved leg to about 45 to 90 degrees based on your feel and strength level. As you squat, shaking is okay, but you should be able to control the movements of your knee. At no point should you feel significantly unstable. The next variation would be for the hip to just be in neutral on the non-involved leg, meaning just simply let your leg hang, but lift the leg off the ground, performing the same squatting motion. The same variables should be controlled for, including the inward and outward movement of the knee, the weight into the heel, the rear end leading the movement, and no knee over the toe. Lastly, you may bring the non-involved leg up into what we would call hip flexion or in front of you, and again, perform this squat. The next movement we'll look at will focus on stabilizing the knee through strengthening the core. This exercise is called the dynamic side plank. You'll start in a regular plank position, performing a push-up. After the push-up, you will turn in to a regular side plank, with the arm coming up as well as the leg coming up. Returning to the start position, down into a push-up, bring the involved knee or the non-involved knee towards the same side elbow, push up, and rotate into the side plank position. This should be done with both the the involved leg down, as well as the non-involved leg down. And you should stay stable throughout the movement. 3 rounds of 10 on each side would be an appropriate goal to begin. Next, we'll take a look at a more advanced movement called a deadlift. Earlier in your phases, we performed an RDL, which is similar to the actual deadlift, except the legs remain stiff. In this movement, you'll be allowed to bend the knees. The barbell or kettlebell should be mid-foot to begin and should stay close and snug to the body throughout the exercise. To begin, you'll bend at the waist, keeping the back straight, knees bent, and pick up the weight. And then push up with both your quads in the front of your leg, as well as squeezing your rear end to complete the movement. Arms stay straight and stiff, and you use your legs to lift the weight. 3 sets of 8 to 12 is appropriate to begin. For your weight should be such that you are able to complete 8 to 12 reps, but with some difficulty towards the finishing reps. Next, we'll look at a little more advanced movement called a single leg RDL. In this exercise, you'll perform the RDL either stiff-legged or with a bent knee, but doing it on one leg, specifically the involved leg first, and then we'll switch and perform the exercise opposite. To perform this movement, you'll need to lift the non-involved leg in the air, straight and behind you, as you control the descent downwards, bending at the waist, keeping the back straight. At the limit of your hamstring flexibility, you'll squeeze your rear end and your hamstring or back of thigh muscle to return to the starting position. This exercise may also be done with a bent knee. To do it with a bent knee, simply bend your knee to begin and perform the same movement. Again, this exercise should be completed both standing on the involved leg and standing on the non-involved leg. Either variety is okay. However, with the bent knee, it will require greater stability control from you. So you may want to begin with the straight leg and progress to the bent leg as you increase your ability to control your knee. No inward movement should be seen during this exercise of the knee, and no pain should be felt. Next, we'll look at a drop squat. This is an advanced movement And to perform this movement, you may think that someone is swinging a sword near your head. To avoid the sword, you perform a quick movement, dropping into a squat. To begin, your legs will be hip width apart. To finish, your legs will be shoulder width apart. It's a quick and controlled movement into a squat. All of the important dynamics of the squat remain. Rear end should lead, knee should stay behind toes, no inward movement of the knee, and no forward movement of the knee past the toes. No pain should be felt in the knee, and you should begin performing 3 sets of 10. If you have difficulty performing this movement, consult your physical therapist and they will begin training this movement with you, as it does tend to be a more difficult movement.
Now we'll take a look at a bit more of an advanced lunge. More advanced because you're going to lunge onto a Bosu ball, and by doing so you're going to decrease your stability, causing your muscles to have to stabilize your knee to prevent it from coming inward or in any other direction that is undesirable. To begin, start behind the Bosu ball about a leg length away. You may then lunge in with one leg, it doesn't matter which, you'll be using both, and perform a lunge with your foot in the center of the Bosu ball. It's important to keep your core engaged and tight, your knee behind your toe, with the weight loaded into the heel, and your knee not to come inwards towards the opposite knee. You should perform 3 sets of 10 of this exercise on both legs. Some wobbling is expected as you are doing these on an unstable surface. Secondarily, you may also perform a sideways lunge in the same manner, about a step away from the exercise Bosu ball, and lunge down and in. All the motions and rules should stay the same, with your knee staying behind your toe, not coming inwards, and the weight loaded into your heel. Again, both sides should be performed, both involved and non-involved, and you're going to perform 3 sets of 10 lunges to begin with. If your gym doesn't have a Bosu ball, ask your therapist how you might modify this exercise to make the lunge harder at this phase.